So my name's Tom Dawson. I'm a consultant paediatrician with a special interest in allergy.
My name is Dr. Thaker. I'm a GP here at Midland Health with a special interest in allergy.
In Midland Health, we offer a paediatric allergy service, and that would involve an appointment. We may do some skin prick testing, which is a way of identifying immediate allergy, or some blood tests to look at multi-component allergy testing.
I think we offer a really good service here. We can do a one-stop clinic for taking a full history, an examination, address any of your concerns, and do testing that's appropriate to what your symptoms might be.
I also offer a service for immunotherapy, which is a way of teaching the body to not make an allergic response to aeroallergens. So for people with severe hay fever who are struggling, we can do that. My service is to benefit the whole family, because actually, although children are those who are suffering with allergic disease, it's often the parents who are bearing the brunt of managing it and struggling with schools and play dates and restaurants and holidays, and it's a very much more complicated problem having a food allergy than people often realise.
We see very commonly conditions where people have struggled getting their symptoms under control with long-standing issues related to allergies such as hay fever, asthma, eczema, and we can offer good, up-to-date treatment for those symptoms that sometimes over the years have been neglected and people have just dealt with buying things over the counter, trying to manage, whereas here we can offer a really good service in trying to help get your symptoms under control and diagnose them correctly.
So the common things I see are food allergy to milk, egg, nuts, wheat and soya. Those are the big 5 allergens, but I've also got children with more unusual allergens such as mustard, and there may be other things such as aeroallergens, which have a significant impact in some people, either affecting their asthma during the summer months, or those people who have hay fever who are allergic to pollens, and those children can benefit from really tight management plans during the hay fever season.
So during that first visit, we offer a good appointment consultation time. So my appointments are 45 minutes when you first come in. We've got time to deal with taking a good history, examine you, and then talk through what your concerns are. And I think that's where people struggle with healthcare appointments these days, where they don't have the time to put their worries across. And we have time to do that during our consultations. What we'll then do is plan any investigations that we need to, talk through treatments that I think are appropriate, and then arrange for any follow-up appointments that we might need.
So I think it's really important to have an understanding of the child and what they do and what their life is like, so that you can tailor their management plan to help them achieve the things that are important to them and their family. So for example, somebody who exercises or someone who travels a lot is probably got different management plans to somebody who's more interested in screen time and gaming.
So with allergy, there's predominantly 2 types of tests that we do. So one would be a blood test, looking for a very specific type of allergy, generally related to food allergies or things that are in the environment. Other tests that we can do a skin prick test, which is what we can do in clinic as well. The way that it affects your quality of life is important. And actually what we can do is actually go through those things, go through those long-term conditions, make sure you're on the best treatment available, make sure that your symptoms are well controlled, and make sure that you're coping with them day to day and they are not affecting your day-to-day quality of life. So the allergy service is available to book online, or you can telephone the reception desk and book an appointment over the phone.
You don't need a referral from your GP. You can self-refer. I think if you're unsure, then I would just make an appointment, and we can certainly see whether there's an allergy involved. And if there's not an allergy and it's a general paediatric problem, I may also be able to help or guide you in the right direction.